I would like to present it about analysis of the impact of reduction of patient visit at Hospital X in Jakarta on income during pandemic COVID-19. So here we goes. Here is the abstract. You could search the keyword COVID-19, minimum services standards, and financial analysis. As we know that with the ministry regulation number 446/2020, all the hospital, both governments and private, that are committed to helping the treat COVID-19 patient will receive reimbursement. So in line with this, Hospital X, which is one of the national referral center for COVID-19 patient, is also entitled to reimbursement. This goes. So Hospital X must have see from the efficiency of spending on care and medical costs, is it accordance with the minimum service standard? Is reimbursement of claims intended to treat COVID-19 patient, is it enough to cover all employees and operation of the hospital? But we also have to view about the number of patient visit and about the risk. So how to analyze the pre and post COVID-19 income according to the minimum service standard for Hospital X? Is it profit or loss? And can the COVID-19 claim now that held by the Ministry of Health use as perimeter if in the future there is an outbreak or emerging infectious disease again? Let's see. So in introductions, in United States, emergency department, the volume decreased nearly 50% as the COVID-19 effect. So this is proof that patients are avoiding the emergency department. So they fears about it because they think it's leading to morbidity and mortality. The author knows that the world struggle with the COVID-19 pandemics right now. So in Indonesia, Hospital X in Jakarta also have decreasing visitation during COVID-19 after the issuance of Health Ministry Regulation number 446/2020. All the hospital, both government and private, that are committed to helping treat COVID-19 patients will receive reimbursement in line with this Hospital X, which is one of the national referral centers for COVID-19 patients, is also entitled to a reimbursement of the ZIS. Hospital X must also see the efficiency of spending on cares and medical costs. Is it enough according to minimum services standards or not? Is reimbursement of claim intended to treat COVID-19 patient? Is it enough to cover all employees and operation of the Hospital X? And we have to see also from the number of patients visiting and acceptable risk. So we move to the research method. As we know, the studies use the secondary data with a quantitative approach. The data collect from analysis claim report is secondary data. This type of research is classified as descriptive with quantitative approach. And the sampling was carried out to use for income data 6 months before and during the COVID-19 at the Hospital X. And we could see now from the workflow management, okay, during COVID-19, before the working in beer clinics, every staff, every person must know how to use the protection for themselves. They have to know how to put it and how to take off the protective equipment. They have to be divided into several teams, which each team must be limited to maximum 4 hours working in isolation ward. This is the protocol. And from the table, you could see the human resources in Hospital X, which is nursery, is the most human resources in Hospital X. To start this research, we must know the total patient that visit Hospital X. We use the data in September 2019 to August 2020. We could see it. COVID-19 is discovered in Indonesia in March 2020, and we could see from the February until March, there are several decreasing patient, whether it's in outpatient or inpatient. We have several decrease here. Therefore, Hospital X is cleaning up and starting to improve room capacity and adding facilities such as negative pressure, because we all know that we have to treat the COVID-19 patient in negative pressure rooms. And before the COVID pandemic, Hospital X has also almost 500 beds, and they are using the government rates. In this pandemic, Hospital X had to adjust to all of the existing facilities according to the minimum services standard patient. These regulations, this have to complete the minimum service standard, regulate everything from the managed patient to the facility infrastructure for COVID-19 patients. So the Health Ministry regulation give us the clear describe about reimbursement. The minimum number of patients receiving reimbursement per day or cost per day is 7.5 million rupiah. When we compare it to the unit costs incurred by a hospital, is it enough to pay all of the costs in the hospital, whether it's the patient needs or for the doctor itself or the operational costs? But the revenue of Hospital X is decreased in April to June 2020 due to decrease in patient. You could see from the table before, significant decline experienced in April until June 2020, but began gradually recover for income in July and August 2020. This is actually not a thing that can be considered positive, because we know all of that increased income also directly proportional to number of COVID-19 patients, which is risk is also exposure for all the patient in Hospital X. So we could say the for a conclusion is, from the data we obtained above, is it clear that Hospital X has decreased income when COVID starts in March, and it really decreased in May and June due to decreasing number of non-COVID-19 patients. This can be caused by several factors, as the concern of the patient who are afraid of being exposed to COVID-19 and others. There was an increase in income in July and August because the total number of COVID-19 patients also increased. This is considered as positive because Hospital X must maintain their cash flow, because they have to maintain the number of human resource as before COVID-19, because handling COVID-19 patient is different from handling non-COVID-19 patient. Person ability to use the level 3 PPE is only allowed maximum for 4 hours. So it can be concluded that COVID-19 patient claim provided by the government is appropriate, so that it can help the hospital in maintaining the stabilization of hospital cash flow. It is hoped that this research can be the basis for making minimum services standard for COVID-19 and can make efficiency and make hospital income stable in the pandemic era. But we also have to think about the risk factor of high patient visiting, also high risk that can happen to all of the person in the hospital. So that's it. Thank you.